So good morning, everybody, and welcome to day 2 of the WES conference. We're delighted to have Professor Emmanuel Ogbonna with us today. Emmanuel Ogbonna is Professor of Management and Organisation at Cardiff Business School, and he's well known to those of us researching in the area of equality and diversity for his highly cited work critiquing organisational equality and diversity policies, and of course highlighting the frequent gap between policy and practice. His research interests cut across the fields of organisational studies, strategy, marketing and human resource management, with recent research in the areas of organisational culture, equality, diversity and inclusion. And his work has explored the position of people from Black and ethnic minority backgrounds in the labour market. He was part of a team that completed a recent British Academy and Chartered Management Institute sponsored project on diversity in the management pipeline of FTSE 100 organisations. And he's currently extending his work in this area to include the impacts of a range of intra-organisational interventions on equality, diversity and inclusion. He's published over 100 scholarly papers, monographs and edited collections, many of which are leading edge contributions in highly ranked international journals. His work has received several national and international citations of excellence, including Best Paper in Research Services, USA, Top 50 Most Read Management Articles and Most Downloaded Articles, and several articles that have been ranked as Editor's Choices. He's currently or past member of the editorial boards of many of the leading management journals, and he's served in advisory and consulting capacities to a range of national and international organisations. He was recently invited to join the advisory board of the new COVID Recovery Commission and is currently advising 5 UK sports councils on their review of race equality in sport. He's also held a number of ministerial appointments, including a member of the Welsh Government's Women in STEM Education subgroup, member of the First Minister of Wales Black, Asian and Minority Ethnic COVID-19 Advisory Group, Chair of the First Minister of Wales BAME COVID-19 Socioeconomic Subgroup and co-chair of the steering group leading to the development of the first All Wales Race Equality Plan. He's also a trustee and vice chair of Race Council Cymru. And as if that wasn't enough to keep him busy, he's made time to come and speak to us today, for which we are extremely grateful. Many of the presentations at the conference so far have highlighted that the COVID pandemic has exacerbated pre-existing inequality in society and indeed across the globe. So Emmanuel's talk is highly pertinent to this theme, and he will explore the impact of COVID-19 on BME communities, giving a view from Wales. So Emmanuel will speak for around 30 to 40 minutes, and then I will take questions by asking people to raise their hands, either using the chat function or turning on their cameras and raising their hand. I think this will be easier than using the chat, although of course people are free to put comments and questions in the chat, but it will be easier to take the questions, I think, from hands being raised. So please, Emmanuel, let's hear your really interesting talk today. Thank you.
Thank you very much, Tessa, and thanks to the organizing committee for inviting me to be with you this morning. My name is Emmanuel, and I work in the business school here in Cardiff, and I am delighted to be able to share some of my reflections on race and race discrimination with you today. I want to begin by presenting something that is very sad in the sense that the pandemic has had a disproportionate effect on people, and especially people from Black and minority ethnic communities. And I want to talk to you about the response of the Welsh government to that realization. We were asked to do a piece of work. We did that work. And from that, I would want to spend time talking to you about something more positive, which is arising from that work. The Welsh government established a steering group to look into the issues and to look at ways of removing that level of disadvantage that Black and minority ethnic people encounter. So I want to spend time doing those two things. I understand that I have 40 minutes or so to speak. So thankfully, there will be ample opportunities for us to discuss the issues, perhaps for you to share your own reflections as well, or indeed ask questions. I would like to begin, as one should at these events, by highlighting a number of caveats, if you like. And the first thing for me to say is that my talk today is about policies rather than your usual academic constructs. And the focus on my talk is the type of things that academics should do, and I don't think we do enough of, which is to influence public policies, if you like, to lead public debates. We do lead on public debates, but I don't think we do enough of influencing public policy. So I want to talk about that today. However, as will become clear in the talk, some of the discussions, some of the things that I have done that I will talk about today are guided by my research interest, the research work I've done in the area of race and racial disadvantage in employment, in organizations. For example, my conception of race and racism, which I was able to influence the Welsh government to accept, but also my work on looking at the gaps in diversity initiatives, the implementation gap in diversity initiatives. Again, it's driving the governance of the plan that we are developing for the Welsh government. So I'd like to acknowledge that it isn't just something that is done independently of theory. The theory and the research experience and knowledge has been very instrumental in a lot of the things that I have been doing in the last 18 months or so. The second point is that I recognize that many in the virtual room would be concerned with language and would want to know why we are choosing particular terms. As I'm sure will be familiar to everyone, there is no single term that is going to appeal to everyone to refer to the people that we are discussing today. At the time of our study in early last year, the Welsh government used the acronym, like every other institution, BAME, B-A-M-E. By the end of that work, they changed that because it became obvious that people, especially young people, did not want to be referred to as BAME. The Welsh government changed that. They no longer use the acronym BAME, but they still call it Black, Asian, and minority ethnic people. So go figure that. But they explicitly ban the use of the acronym BAME. I know why. The reason really is because the vested interest amongst the different groups do not want their identity to be lost in the name. So the Black, Asian, the two dominant ethnic minority groups, both want their names, their identities to be reflected in any name that was chosen. And as such, there is no way out of it. And in Wales, they've chosen the option of going for Black, Asian, minority ethnic communities, but not the acronym BAME, which is quite interesting, and we probably will come back to that. But there is no name that is acceptable to all, as you know. People don't like to be called people of color, as they do in the United States, very comfortably. British people don't want to be called people of color. They don't like to be referred to as non-white. And there are many other things they don't like to be called. But there are some that are more likely to be accepted. For example, ethnic minority it remains probably the most accepted term, although some people don't like it and would prefer it to be minority ethnic to de-emphasize certain things. I tend to go with Black and minority ethnic communities. I think it's widely, it speaks to the two areas. It uses Black as a representation of the color element. Black, of course, has that long history that is associated with the civil rights movement, the struggles emanating from the United States but spread all over the world. And also the ethnic minority element, which is important. It's important because many of these discourses often focus on the needs of or the experiences of the dominant groups, and they tend to be based on color. Then it's the Black people or the South Asian people, and many of the other minority groups are not always included, but also many of the other ethnic communities are not included, including sometimes white minority ethnic people who also experience disadvantage on the basis of their ethnicity. And of course, the Gypsy, Roma communities, traveler communities are nearly always excluded in these discussions. So it's important to emphasize that we are not just dealing with skin color here, but we are also dealing with ethnicity, and that is useful for us to understand. But of course, we're talking about people from Black and minority ethnic communities. We also know that this is not a homogeneous group. There are all sorts of differences within and between them, and that needs to be acknowledged as well. Racism sometimes is subsumed in discussions of diversity and inequalities, but also sometimes discussions of class. And more recently, we know that the certain government has been promoting the problems of working class people and pitting them against other groups like ethnic minority groups and indeed women and maybe even, who knows, the disabled, and arguing that we should focus more on class as opposed to those areas. And of course, we know that race and class intersect, but we also know that they are different things. They are different constructs in their intention and in their outcomes. And we should focus on inequalities in general, and class-based inequalities are terrible, and we know how they manifest, and we know some of the policies that have fueled them in recent years, but we cannot overlay them on the problems of ethnic minorities, because then it conflates matters. We should treat them as different things. We should think in terms of the fact that a person who is disadvantaged, a white working class person, may be disadvantaged or will be disadvantaged by their class, but they will not be disadvantaged by their race. An ethnic minority working class person, of course, has that double whammy, and we should always emphasize that. And this is one of the reasons when I talk to people and they worry about the notion of white privilege, I always say to them, it's not designed to mean that all white people are privileged. It's simply saying that people are not likely to be discriminated against on the basis of their white race, but any other person who is not white is likely to be discriminated on that basis. And as such, that white person has that implicit advantage. So I think we need to think about all these issues. And my last point, I think, on this is to think about the fact that although many of the issues I'm going to talk about and we identified in our report for the Welsh government addressed ethnic minority people, they weren't actually peculiar to them, in the sense that we already know that the real fallout, or one of the main fallouts from the pandemic, not the real, one of the main fallouts from the pandemic has been the impact on women, the people who are really bearing a lot of the impact. Women, they are disabled people, and then young people, of course. So these are the people that are equally affected by a lot of the issues we identify. But then in that regard, spare thought then for Black and minority ethnic people that are women, that are young, and that are disabled. Their problems are likely to be worse than anybody else's problem. So it's important for us to think about those. And of course, what all these caveats tell us is what we told the Welsh government, which is that one should always be conscious of how one analyzes the experience of people because of the intersections of identities, and that one should always look at this in an intersectional manner, which is something I'm sure everybody in the virtual room will agree with. So it was April of 2020 when the Welsh government invited us to look at the disproportionate impact of COVID-19. Data was beginning to emerge that Black and minority ethnic people were disproportionately impacted by the outcomes of COVID. They were dying more, they were catching it more, they were dying more at the time. And I was invited to lead one of the two subgroups that was created from the main group, and that was the socioeconomic subgroup. And we began our work in April 2020, and were asked to submit a detailed account to the First Minister by June of 2020. So it was quite a work at a frenetic pace. But to put it in context, at the time, sometime last year, middle of last year, thereabout, Institute of Public Policy Research provided a report that concluded that between March and May of 2020, all BME groups, Black and minority ethnic groups, except Chinese groups, had higher risk of dying from COVID-19 than their white counterparts. For example, the death rates were something like 3.3 times higher for Black males and 2.4 times higher for Black females compared with white males and females. The IPPR further estimated that over 2,500 deaths could have been avoided in England and Wales alone had BME groups not been at an increased risk. Conversely, they also pointed out that 58,000 white males and 35,000 white females would have died had white groups been at a similar or the same level of risk from dying from COVID as their Black and ethnic minority counterparts. Now, these analyses were carried out last year, but the pattern was continued. And the evidence overall seems to suggest that people from Black and minority ethnic backgrounds are up to 4 times more likely to die from COVID than their white counterparts. So the question then is, what factors are responsible for this? And this is what we try to look at in our report. And our report highlighted a number of factors. Many of them are now widely accepted. In fact, everybody now that is research this area agrees, at least every reputable institution or outlet that research this area now agrees that the factors are more or less identical. And hopefully you would have time to read the report in full, which is in the Welsh government website. But what I've tried to do is to aggregate the common issues to 4 headings, which now corresponds with the headings that other reputable reports, the conclusions they arrive at. And the first one is deprivation. The second one is overexposure. The third one is comorbidities, and the fourth one are the unexplained factors. And I will go through this in turn. I don't want to spend too much because I want to go over to the more positive news on what the Welsh government is trying to do. But if I start with deprivation, some of the risks are well known. Black and minority ethnic people are more likely to be poor. They're more likely to be deprived economically. Their risks include high levels of poverty. They are more likely to work into their later years. They are less likely to own their own homes. They are more likely to live in overcrowded accommodation. Living in overcrowded accommodation, incidentally, is a combination of social factors, but also economic factors. Social factors in the sense that culturally, many people from Black and minority ethnic communities don't tend to like putting their older relatives in care homes. They don't have the same culture that other cultures may have, if you like, of putting older relatives in care homes. So they like to stay in the same homes to look after them. And as such, if they are poor, they are less likely to afford some of the necessity to have the numbers of people living in the same accommodation. So the homes are smaller, and then overcrowding ensues, and that means they are more likely to catch and spread. If they have COVID, they are more likely to spread it anyway. So deprivation is a key factor, which is, I guess, self-explanatory. The second factor is overexposure. Black and minority ethnic people tend to be overexposed in the industries or sectors where they are more likely to come into contact with COVID and also catch the disease. And as such, when they catch it, the likelihood of them dying would then increase significantly. They are more likely to be in low-skilled occupations. The conference is about precarity. You think about number of precarious workers that are from Black and minority ethnic communities, numerous. The people that are more likely to serve you on the tills when you go to supermarkets, the taxi driver that is more likely to pick you up, the bus driver that is there, the delivery drivers, the Uber Eats drivers that we tend to use, because we have the luxury of staying at home, and all these people go out to work during the pandemic. So that level of overexposure, of course, means that they are more likely to catch the disease and suffer the consequences from it. If you look at it in Wales, we had found that 33% of people in Wales are 33% of medical doctors in Wales are from BME communities. That is significant. 1 in 3 doctors in Wales are from BME communities, and that is quite significant. I think other figures actually say it's more than 1 in 3. I've read somewhere where reports say it's about 40%, in fact. So a significant proportion of the doctors in that sense from these communities, and that in itself exposes them at the front line because they are at the front line of medical practice. And many of these doctors are locum doctors as well. For whatever reason, they've chosen to be locum doctors, whether it is because of discrimination or whether it is because of personal choice, but locum doctors don't have a home, as it were. They serve as the rings of defense that are there to cater for us when the regular medical people are unable or unwilling to come in. So they were more exposed to this virus in that sense. But there is also some other thing, the peculiar practice in the NHS. Many of the doctors that were recruited from India, from Nigeria, from Saudi Arabia, from everywhere in the world, were not actually given the opportunity to train to become consultants in the same way as UK-based doctors. Instead, they were put on positions that they commonly refer to as staff grade. The staff grade doctors, many of them maybe were consultants in India or in Nigeria or wherever before they came, but they're put on this staff grade here. So they will never be consultants, but they are essentially doing the work of consultants. They know they're highly experienced, so they do these jobs, but they are then the ones that are on the front line, whereas the consultants will be out of it, and they are the ones that were exposed. So it's not surprising that so many of the people that died were doctors. It's nothing to do with the poverty, and in that sense, it's just to do with the discriminatory policies that may make it such that they were exposed to the virus. The third factor is comorbidities. And here, comorbidities, we're talking about the fact that BME people often suffer from these illnesses. That's known. Diabetes tend to be common amongst Black and minority ethnic people. Hypertension tends to be common. And we know that already. And early on in the pandemic, if you remember, we were told that this was why more people were dying from BME communities. But I came across an article in The Lancet, which did an analysis of a major study. And I realized that actually that wasn't the full story. This report found that, in fact, diabetes and heart disease and hypertension did not pose the greatest adjusted risk of dying, adjusted comorbidity for COVID-19. It was, in fact, dementia. Dementia posed the greatest adjusted risk of dying. So dementia was the greatest comorbidity in terms of dying from COVID. And the risk factor, they analyzed this, was 1.4 as opposed to diabetes, which was 1.1. And the other thing this investigation found was that age was, in fact, the single highest risk factor of dying from COVID. And the adjusted ratio for age was 9.09 for those people that were between 70 and 79 years of age, and 11.72 for those people that were over 80 years of age. So that is quite significant. Compare this: dementia, 1.4, diabetes, 1.11, and 70 years of age and above, 70 to 79, 9.09, and then 80 years and above, 11.72 when compared to people under 50 years. That is significant in that sense. And then the study then went on, this particular study that I was reading, then went on to look at a particular instance where so many patients were in hospital. I think it was about 3,000 or so admitted for COVID. And what they found was that 60.7% of the people that were admitted, the white patients, were over 70 years of age, compared with around 30% of the Black patients who were about 70 years of age. So when one looked at it in theory and looked at the risk of dying, one might expect that there will be more white people dying from the disease than their ethnic minority counterparts. However, 30 days on from admission, they found that the death rates were identical for both patients. And that led the researchers to conclude that COVID deaths were not simply related to the factors that had previously identified, that there were other factors that were currently unknown. And this is where we come to the fourth factor, the unexplained factor. This is where our report for the Welsh government identified institutional racism as that fourth factor. And we all know what institutional racism is. Sir William Macpherson defined it for us. He defined it as a collective failure of an organization or an institution to provide appropriate and professional service to people because of their color, their culture, or their ethnic origin. We know that it can become ingrained, and it can become ingrained in systems and in the culture and structures in ways that become taken for granted. And this was what we found in Wales from talking to people, from reviewing reports. We found that Black and minority ethnic people in Wales simply did not believe that anything different would happen. Whereas for other people, the outcomes from COVID were surprising. For Black and minority ethnic people, it was almost expected because this is the life they lead in every day, on everyday basis. Why did we come up with that? We came up with that not just because we talked to people and we read the reports that had been written previously for which no action had been taken, but also because we looked at data externally that supported our conclusions. So for example, the National Center for Social Research, they do this research every so often, and the last one was in 2017. And they did a sample of British households, and a staggering 26% of people in Britain, they took a representative sample. 26% of a representative sample of British people admitted to being racially prejudiced. Now, this is self-admission, which is unusual because people don't normally like to say they are racist. So if 26% of people are saying they are racist, that means a lot more people are racist. We also have data from the European survey, social survey, which found that 44% of British people believe that some races or ethnic groups are born harder working. If you imagine a manager in an organization that believes this, then everybody else in that organization that is of ethnic minority extraction will be in deep trouble, because before you do anything, your manager already believes that you are born not as hardworking as the next person. And that is quite dangerous in that sense, because it becomes ingrained as part of the culture and begins to facilitate this silencing and omissions, this notion of ordering that can easily be traced to the history of racism. Those people who don't have the ancestral advantages are then the ones that suffer the significance. We haven't opened ourselves up as a society to scrutinize these attitudes. In the past, we haven't. Racism was seen as an ugly word. Nobody wanted to talk about it. It wasn't until the coronavirus and the awful killing of George Floyd in America that people began to talk about it. And thankfully, we began to talk about it. Out of those horrible events, something positive might just emerge. But what is happening is that coronavirus is not killing people, and it's continuing to. It's not killing people because they are Black or minority ethnic. There is nothing inherent in the genetics that is making people die, contrary to what some people may want to believe. What is killing people is the racism that being Black and minority ethnic subject people to. That is the thing that is making people die from the pandemic. One example, we found that ethnicity and age are the two key factors that are implicated in COVID deaths. What did the government do when we found a vaccine? We prioritized age, but not ethnicity. That is because there is something inherent in ethnicity, that race and ethnicity, that really people in authority don't seem to care about. We know that it isn't to do with poverty. The first 60 people that died, 60 of the first 100 people that died, medical people that died from this pandemic, were from BME communities. So it isn't because of the poverty or levels of poverty. We know that it is the repeated exposure to racism and racial discrimination that contributes to the type of ill health that increase the susceptibility of people to A, catching the disease, and B, dying from it. Research in America is already established that repeated exposure to racism is tantamount to post-traumatic stress disorder. That is what makes it difficult. And if you imagine what it must feel like for an ethnic minority person working under this pandemic, you have this anticipatory stress of racism. You know it's going to happen, and it just wears you down. And over time, it begins to eat into your own capacity to cope. The capacity that individuals have to be able to withstand these diseases will just wear off, and your susceptibility to obesity, to heart disease, to hypertension, all these things increase the likelihood of catching and dying from COVID-19. So the Welsh government accepted our plan, our report, and that was gratifying, because we struggled with some of the conclusions with civil service, but in the end we prevailed, and the Welsh government accepted the report. And the Welsh First Minister then set about establishing a steering group to look into the issues and to develop a race equality action plan for Wales. And we began that work shortly after we submitted our report in June last year. And we've been given a free hand to develop a plan. We successfully argued that the only way to deal with institutional racism is to commit to anti-racism. Why do I say that? I say that because I conceptualize racism not as a dichotomous construct, whether one is racist or anti-racist, but as a continuum, something that operates on a continuum, where the one end may be racist, the one may be anti-racist. But if you look at society, the way society is structured, roughly, perhaps around a third of people will be anti-racist, but then around a third of people would also be hardcore racist. And the rest of the people will be somewhere in the middle, depending on how the wind blows. And it is this rest of the people really that we need to capture to move them towards the other end of the continuum, the anti-racist end. And the only way we can do that is to develop anti-racist policies. Why do I say that the middle is full of people that are going with the wind? I say that because most people, practically everybody that says they are non-racist, at some point or the other would have been exposed to some sort of racism and racial stereotypes. And these stereotypes don't go away. They stay with them, and they are activated at times of uncertainty. So when they were growing up, when they were in schools, in their household, they've been exposed to these negative stereotypes, and then they become exposed later on in life. So if we went for anti-racism, as we are doing in Wales, we are able to tackle those negative stereotypes from source. We work on the assumption that there is zero tolerance on race and racism. That's because I don't believe that anybody can be neutral on race. You are either a racist or you are an anti-racist. And I think that sounds harsh, but in reality, those people that think they are not non-racist can often, if they examine themselves, be subjected to situations where they act in racist ways, even if they are not aware of it. And this is why we often speak of unconscious bias. Unconscious bias simply means that we haven't articulated properly how our thinking can impact on people of other races. We haven't thought about the consequences of our behaviors, so we see them as unconscious. Being anti-racist means that we subject those values and biases to scrutiny, and we reflect on them at all times and see how they may impact on other people. The plan we are developing in Wales is significant in that sense. The plan is also significant because it is a co-creation of efforts from everyone, all stakeholders, not just the Black and minority ethnic people, not just the civil servants, but also all stakeholders. including people who run parastatals, institutions, including white people as well, because they themselves are also beneficiaries. They are affected by race, issues of race and racial disadvantage. Even when people think they are going to lose out, we're presenting a narrative that makes this a win-win situation. There are moral imperatives here, but there are also economic imperatives. Some of the arguments that I've been using with the Welsh government and others, the ethnic minority population is skewed towards the younger age groups. We've come to a point in history now where we have more people over 65 than under 5. The white birth rates are something around under 2%, or just about 2%, just about 2. That's not good enough to replenish the population that we need in going forward in the future. The ethnic minority birth rate is higher. So there are economic imperatives. I ask the question, who is going to pay for our pensions in the future? They are the young people that are being born today. And if you have more of them in the ethnic minority categories, and you don't set the framework and the foundation where they feel involved and feel valued and get the best education and get the best opportunities to get jobs, who is going to pay for the pensions in the future? So there are economic imperatives, not just moral imperatives. And it is a narrative that is taking hold in Wales because we are driving forward with this race equality action plan. And I want to just tell you briefly before I finish why I think this will work. I think it would work because the government is highly committed to this agenda. It is one of their flagship policies for this election, during the election year. And I think it would work because when we were writing the socioeconomic policies, socioeconomic report, the civil servants in the group did not want us to use the conclusion of institutional racism. I asked for a meeting with the then Deputy Minister and Chief Whip, and I said, we have to be allowed to do what we want. And the politicians overruled the civil servants and asked for us to be given the free hand to do what we wanted. And that was unusual, as later emerged in a different context, which I am sure is known to everybody in the room. But also, the First Minister of Wales earlier this year recognized that, like many white people, he may not have sufficient, he and members of his cabinet may not have sufficient understanding of institutional racism. And they asked me to design a training program for them. And I ran a training program with the First Minister of Wales and the entire Welsh cabinet on institutional racism, which was just lasted for about 2 hours, or just under 2 hours. This was in March, just before the election. So he put out a 3-line whip that everybody must attend this training. It was that significant, it was that important to him and to his cabinet. We've done the same thing as well. I've done the same thing with the top 100 civil servants in Wales. And my last point, I know we're running out of time. My co-chair on the steering group, the permanent secretary of the Welsh government, who is the highest ranked civil servant in Wales, has so much bought into this ideology that, she has actually gone to change her key performance indicators to include leading an anti-racist civil service as one of her key priorities. And this is an example of somebody putting their money where their mouth is. And if everybody in the senior position did that, then we will turn the country overnight to be anti-racist. Whatever the case, Wales is en route to become the first anti-racist country in the world. Thank you very much for listening to me.
Thank you very much, Emmanuel, and what a note to end on. I think what you've shown us really is a wonderful example of how academic research, theorization, and experience really can feed into policy making and at the highest levels. When you can actually articulate in ways that politicians, I suppose, are able to understand. And I thought it was very interesting that you gave us some insights into some of the resistance to what you were saying, but how you persuaded them that your approach was necessary for change. So I really enjoyed that, and I'm sure there'll be lots of questions